Good morning and welcome to Pharmacy House Australia. Today, I'll be discussing Part C of the Pharmacy Oral Exam, which focuses on problem solving and communication skills. This section requires the candidate to utilize their medication factual knowledge, apply it to practice situations, and effectively communicate with patients and health practitioners. This section is 20 minutes and conducted as a role play. Let's dive into it. Part C of the Pharmacy Oral Exam involves analyzing a prescription and the pharmacy's own patient dispensary medication history. It requires eliciting additional relevant information through appropriate patient history taking. The aim is to identify and address any problems or main issues. And very rarely will there be no problem with the scenario presented to you. Pause the video here to read what sort of problems or issues may arise in your scenario. Now, let's explore an example scenario. Imagine a patient comes into the pharmacy with a prescription for a medication to treat high blood pressure. Perindopril 5 mg. You notice that this patient does not have a dispensing history at your pharmacy. What do you do? To address this issue, I would initiate a conversation with the patient to gather more information. I would start by introducing myself and creating a comfortable environment for open communication. Using clear and appropriate language, I would ask the patient about their medical history, including any pre-existing conditions, allergies, and all the medications they are currently taking. Part C of the oral exam is open book, so you can check any offline resources. For example, if you did not know the side effects of perindopril, you could check your Australian Medicines Handbook under the antihypertensive section. Once I have gathered all the necessary information, I would consult the patient's prescribers to discuss the problem I have found. Clear and concise communication with the prescriber is essential, ensuring that all relevant information is conveyed accurately. For example, in this scenario during history taking, I asked the patient how long they had been on the medication and if they experienced any side effects. I asked questions like, how are you going with the medication and has anything changed since starting the medication? The patient revealed they started perindopril 6 weeks ago for hypertension and have been experiencing a dry cough ever since. I informed them that perindopril can cause a dry cough as a side effect and offered to contact their doctor to explore a suitable alternative. When calling the doctor, have a recommendation ready to go so your communication is clear. For example, "Hi, doctor. I'm Brian, the pharmacist from next door. I have a recommendation regarding Mrs. Citizen's prescription for perindopril. She informed me that she has been experiencing a persistent dry cough since starting the medication. This cough is a known side effect. I suggest switching her to candesartan. What are your thoughts on this alternative?" Be ready to then communicate this conversation with the doctor back to the patient in role play. Discuss what did the doctor say and will you be dispensing the prescription today? If you will not be dispensing the original script, will the doctor be sending the pharmacy an alternative prescription?
Hi, I was wondering if my prescription for perindopril is ready.
Hi Mrs. Citizen, thank you for waiting. I just got off the phone with your doctor as I was concerned about the potential link between perindopril and your dry cough. It is a common side effect of this medication. Your doctor advises discontinuing perindopril and transitioning to candesartan instead. Candesartan is also effective for hypertension but does not carry the risk of causing this particular side effect. Your doctor is faxing the pharmacy a new script as we speak. In the meantime, I would like to provide some counseling on this new medication. Would this be all right with you?
I see. Thank you for this. Yes, I would like some counseling on candesartan, please.
Complete the role play by providing the patient with full counseling on the candesartan, including how to use it, monitoring points and what to expect. You can also check out our in-depth video on how to correctly counsel patients by clicking on the video link in the description below. Remember, Part C of the Pharmacy Oral Exam challenges candidates to tackle real-world problems related to medication and patient care. By effectively communicating, actively listening, and demonstrating proficiency in decision-making, candidates can achieve satisfactory patient outcomes while showcasing their expertise in the field of pharmacy. We hope you found the example scenario and tips helpful in understanding how to approach this section effectively. If you enjoyed this content, make sure to subscribe to our YouTube channel for more educational videos and exam preparation tips. Stay tuned for valuable insights and information in the world of pharmacy. Thank you and best of luck on your own journey in the field of pharmacy.